Welcome to Grand Rounds. I'm delighted to be your host this morning as Dr. Chakraborty is away. This morning's Grand Rounds topic should be of interest to everyone as we talk about QI and its relationship to research, something that I think many of us struggle with and seek to gain clarity, and our speakers today will help provide that. I'm going to begin with a land acknowledgement before I introduce our speakers. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them in this land. Their culture and presence have nurtured and continue to nurture this land. CHEO also honors all First Nation, Inuit, and Métis peoples and their valuable past, present, and future contributions to this land. And as we think about our Indigenous colleagues and friends, we also need to turn our minds to think about our friends, family, brothers and sisters in the Middle East and the crisis unfolding there and the tremendous challenges that people are facing, and wishing everyone speedy peace. So our two presenters this morning are Dr. Claudia Malic and Dr. Leanna Isserlin. Dr. Claudia Malic is a pediatric plastic surgeon. She's the vice chair of quality for the Department of Surgery at the University of Ottawa. She is also the surgeon champion for the PNSQIP and the lead of the perioperative QI program at CHEO. She's an associate professor at the University of Ottawa, an alumni of the ICES Faculty Scholar Program, and has further expertise in health informatics. She finished her certificate in safety, quality, informatics, and leadership with Harvard Medical School, and has a continuous commitment to scholarly work with over 50 peer-reviewed articles, over 80 national and international podium presentations, and over 40 national and international posters. Her work is focused on implementing learning health systems in Canadian settings. Dr. Leanna Isserlin is a child and adolescent psychiatrist at CHEO and an assistant professor at the University of Ottawa. She's the corporate medical director for system and quality improvement at CHEO and medical co-director for the CHEO eating disorder program. She trained at Dalhousie, followed by her residency in psychiatry with a diploma in child and adolescent psychiatry at Western University, and is currently serving as the acting chief of psychiatry. So both lots of experience in QI and translation and implementation. That's actually the title of their presentation, Updates on the QITI Awards, Quality Improvement, Translation and Implementation. Dr. Malic is going to speak first, and then we'll take questions as she has to go to clinic. So please direct your questions for the first half of the presentation to Dr. Malic, and then Dr. Isserlin will speak and take questions at the end. So welcome to our speakers, and welcome everyone. Claudia, it's over to you.
Good morning, everyone. Thank you very much for providing me the opportunity to give some updates with regards to the QITI Awards. Can you see my screen?
Yes.
Okay, so the objectives of today's presentations is to describe the aim and processes for applying for the QRI, QI, and QITI grants, familiarize participants with the new QI project review process launch at CHEO, and to explain the link between the QI process review process and the QITI grants process. So what is QITI? QI is coming from quality improvement, either initiatives, implementations, and TI, it comes from knowledge translation and implementation. And this was an idea from Dr. Berman when he came at CHEO. So he's been around for a few years, but there were a few kinks that we need to iron up and to develop a framework and people to be aware. So the aim is to support QI activities at CHEO, as well as the knowledge translation and implementation evidence to be placed in practice at CHEO as well. Why that? Is because we want to become a true learning health system. And when you're looking for a true learning health system, we have data. That data can develop knowledge, and the knowledge then needs to be implemented into practice. And then how we can evolve our practice and provide more data. So that cycle is continuous. It has a multifaceted approach, and you require a multidisciplinary team for that, with strong patient's voice as well. So our aim was for the QI and KT, the two parts of the grants, to be part of this process. There are two streams. There is a level 1 award and there is a level 2 award. The level 1 is up to $5,000 per award and is for a 12-month length project, whereas the other ones are for 1 or 2 years. And it's more about implementation or sustainability of initiative. The priority areas for the award applications is to improve the wait times for healthcare, to reduce the need for healthcare. They are aligning with the CHEO priorities as well. To improve access for underserved population, reduce and identify unnecessary costs, to improve and identify effectiveness and efficiency in different clinical areas, to prevent harm, and also to reduce unnecessary tests and treatments as per Choose Wisely goals and vision. For this application, you need to have two lead applicants, and there are the co-principal investigator, and they should be from different healthcare professional backgrounds. So they cannot be two occupational therapists or two physiotherapists or two physicians or two nurses. We just want the teams to be multidisciplinary, as we want as part of the concept of the learning health system. They should be permanent staff member of CHEO, or if they have a primary appointment at the CHEO RI. Could be also trainees at CHEO or from the CHEO RI, as long as they identify a co-principal investigator with a primary appointment at CHEO RI. Exclusion criteria, as I said, no two applicants from the same background in healthcare professionals. Applicants with completed QI grants that have submitted the QI, the final reports are eligible. But if you had a previous year a QITI grant at the time of the application, you will not be eligible. And it's one application for each investigator. You cannot be part of 2 or 3 applications. The question that we had when we launched this one first a couple of years ago was what it is QI and what it is research. And new QI process review has been placed at CHEO, and that's why the lag between the first award and currently when we'll launch it again, hopefully in the 2024. It needs to be done prior to the LOI. And the letters will be provided for this award application. So it will be part of the application packages. And Dr. Isserlin will present this morning how the QI review process for CHEO works at the moment. With regards to the application, so we will have, as the first stage is the letter of interest. It's 1 page. It's got a project title. We'll need to name the team members, what type of application stream is applying for, and you will have a project summary, as we have for is the similar structure as for other grants from the RI. And the Family Leader Program will review the application, and when is provided the full application process, a letter from the Family Leader Program will be required as well. The full application, again, project information, some administrative informations, a lay summary, a project description with a statement, background, implementation plan and impact, the expertise of the team to lead this project, the family leader feedback, and will require a development plan as a timeline for the level 2 application. It will be also a budget. There is a format template, and there will be eligible and non-eligible expenses. In annexes, we'll have references, we'll have letter of commitments from the project sponsor. So the project has to have a sponsor in order to be supported and also to facilitate and to remove any barriers that the initiative may have. Other letters of support and the CVs of the team members. As part of the QI, we would like a reporting. So a final report for level 1 should be submitted within 18 months of the initial award notice. And for the level 2, an interim report ideally 12 months should be placed should be submitted, but we're saying 12 to 18 months from the initial award notice, and a final report will be required as well till up to maximum of 30 months. All this information there is on the GeoRI and also on the GeoNet with the details and also with some drafts of the applications. We're still working on the application and the terms of references and the description how we should fill in the application. But for anything else, please reach out to us or Samira or Dr. Berman or myself. Thank you very much.
Thanks very much, Claudia, and thanks for all your work in leading and chairing this committee. Questions for Claudia before Leanna speaks around the broader QI process at CHEO?
An estimated timeline, like when the first LOI will be due and when funding would happen?
So most probably we're looking into the new year. The dates, we can choose either spring or autumn, but depends when there are others, CIHR grants and other grants, and we don't want to interfere or to draw attention from it, but we will give plenty of notice, and also we'll try to find different way to communicate so people are aware that we are putting the letter of intent. It doesn't. You can apply either for level 1 or level 2. It doesn't have to be level 1 first and then the next year level 2.
Any other questions? We should be able to post the dates early in the new year so that people will know when well in advance when the LOI is due and when the full applications will be due and when the funding would start. Any other questions for Dr. Malic? And again, if you have further questions around this process, please email Claudia or Samira or me.
Thank you very much, everyone.
Thank you. Thanks for coming. We'll turn it over to Dr. Isserlin.
Thank you. And I'll just share my screen with slides. See if I can. All right.
You can see them. They're perfect.
Okay, great. Just trying to get them into presenter view, which can be a little tricky. So thank you so much for this opportunity that is quite timely to be able to speak to you all about a new process that was launched at CHEO just at the beginning of this month. That really coincides nicely and is now integrated into the QITI grant process. So as Claudia noted, the overall objectives for our talk this morning include the pieces that Claudia has already reviewed, and I'm going to focus on the second objective here to help familiarize everyone with the new QI project review process that we launched. I hope that this is not the first time you're hearing about this process, although I will go through it thoroughly in case it is. But we have been trying to push out communication and meet with a variety of groups to make sure that everyone is aware of this new process. Developing this new process was a QI project in itself. So we launched this new process at the beginning of December, but it will be one that we continue to improve over time. And we were really hoping to receive feedback from those that are accessing the process to help us understand how we can optimize it. First, I want to acknowledge that while I'm here talking about this morning, that many individuals were involved in the development of this new process, including Claudia and my dyad partner, Danielle Simpson, our project coordinator and GeoWorks admin, as well as a large number of stakeholders and collaborators. And we also worked closely with the REB. So just by overview of my presentation, I'll tell you a little bit about where we started out just over a year ago in 2022, what we felt the problem was at that time, the process that we followed to develop an improvement or to try to improve the situation, and then what we have launched in December. So just by way of principles, we recognize that QI and research are distinct fields, but there are challenges in this area because in some ways they can feel very similar. So research and quality improvement are both systematic and involve the gathering and analysis of data. And over time, as the field of QI has developed and the methodologies have become somewhat more complex and rich, in some areas, there is a lack of clarity between what those terms mean and what can feel like blending of the methodologies, which can lead to confusion about whether a project is entirely in the realm of QI or if it also involves some elements of research. And of course, this is an important question to have answered because any projects that involve elements of research would require REB approval prior to commencing the project. So in the autumn of 2022, we really didn't have a process specifically designed for folks at CHEO to help project leads differentiate whether their project was QI or research. And so what was happening, or the direction at that time, was if you were in doubt, that you should reach out to the REB to ask for feedback, and or if you were planning to publish the results of your QI project, that you would need an REB exemption letter, and the REB would issue that after reviewing the project based on some communication with the project lead. We recognize that in other institutions, this was different and potentially felt a little more organized and streamlined. So the problem that we had identified was the current process for the project leads really was somewhat unclear, and for some it felt quite time consuming and a bit tedious or difficult to understand. And we really felt that the project leads would benefit from a more streamlined process that would be able to help them to determine if their project is QI versus research without actually having to go through completing an REB application, and that either an REB exemption or institutional approval letter could be issued so that project leads could move on to publication of their projects if they decided to at the conclusion of their QI project. We also recognize that there were other opportunities, including the opportunity to be able to help project leads to use appropriate QI methodology and to really reflect on the importance of ethical principles in completing QI projects, and to be able to provide some information about what supports are available at CHEO for QI projects and QI project leads. And also the potential opportunity to create a database of all the QI projects that are taking place at CHEO, which we know a lot of QI work is done at CHEO, but we really don't have a good way of keeping track of what's happening, and feel like it would be really wonderful to be able to demonstrate our productivity in this area, even if we don't publish all of the project results. So we started with an environmental scan and came quickly to realize that there's quite a bit of variety between hospitals on how QI projects are reviewed, and how that's integrated into other structures within the hospital, including the REB. So there were a variety of options as to who would be doing this review, including just the REB chair or manager, the REB subcommittee of the REB, or a separate committee that was designed to review QI projects. There was a variety of ways in which these project leads were being guided to determine if their project was QI versus research, including just a self-screening tool, plus the option to have the project reviewed by a committee or individual, and in some cases a mandatory project review. And then additionally, you know, the sort of sequence or how this would occur for project leads. In some cases, it was a one-time review. In other cases, a self-directed re-review if the project changes scope. And in other cases, a mandatory progress report at 6 months or a year. So we had a whole host of different options for how we would move forward. And so our next step was to engage the stakeholders. And you can see here that we cast our net wide as far as trying to engage stakeholders, recognizing that QI touches almost everybody in our organization, and that we wanted to have input from a large variety of people to make sure we were creating a process that would be accessible to everyone and helpful to everyone. So we met with the stakeholders on a number of occasions and were able to gather really helpful feedback about how we wanted to set up this new process. Some of the feedback that we received from the stakeholder group was the importance of maintaining an inclusive and organizational-wide culture of QI, that it was really important to work closely with and align with the REB. That really we had the opportunity, since it was a new process, to try to start on a smaller scale, to get something out there and working for folks, but then be able to build on that over time, which really fits with the conception of quality improvement in general. And that it was very important that the final process be efficient to prevent creating barriers to engaging in QI, which we want to make sure people are able to do in a fairly seamless manner in order to keep people engaged in QI. We know they're busy with other things and didn't want this to bog them down. So we developed an aim statement, which was we will create a QI review process that will help everyone at CHEO efficiently determine if their project is QI or research, and felt this is relevant for many of the reasons that we've already talked about, including the importance of being able to pick up on those elements of research that might be involved in these projects early on, because REB approval cannot be provided retroactively. We really wanted to make sure that people weren't moving forward with projects that they were presuming were fully QI and later determining closer to the end of their project, especially if they went to publish it, that it included elements of research and they had actually completed a research project with our REB approval. The goals of this review process were conceptualized to be to help project leads be able to distinguish between QI and research, to allow for an institutional approval letter to be issued to anyone who requests it. And we hope that people will have a low threshold for wanting to receive these letters, because sometimes you don't know at the beginning of a project that you might want to move forward with publication. But later on, that might become something that you're interested in. And we do want to promote more opportunities for folks to be publishing the results of their QI work so that we can tell the world about all the great work we're doing here in QI at CHEO. And then to be able to provide written information on appropriate methodology, ethics, and available resources at CHEO for QI project leads. There are some things that are not in scope that are important to talk about, or not in scope at this time. So this is not a process that approves QI projects going ahead or not. It's really a process that will help individuals to determine if their project is QI or if it includes research. Approval of whether QI projects go ahead is really at the local level with the project sponsor determining if it's the right time and if resources can be allocated to that project, which may be as simple as people's time and the effort that goes into completing the project, or as complex as resources from the hospital and finances. Completing this process does not lead to the provision of project resources, including other than the written sort of information that's available for individual project leads. It doesn't automatically provide resources in the way of quality improvement advisor time or project managers. As Claudia mentioned, it is now part of the process for applying for a QITI grant. So if you continue down that process, there's an opportunity there to receive grant funding. And we are not at this time ready to create a database of all QI projects taking place at CHEO, but maybe an aspirational goal for the future. So after all of that, we were able to put together a new process and launch it at the beginning of December, which I will tell you about now. So this is a flow chart of how the process rolls out. So the yellow arrow is where people enter into the process by completing an online self-assessment tool. And I'll show you where on CHEOnet you can find that tool. And then once the tool is complete, it will give you feedback. It will automatically, it will either tell you that based on the completion of the self-assessment tool, your project appears to include elements of research, and you would be directed to the Smart Start system, and then ultimately to the REB. And or it will say, based on this self-assessment, your project appears to be entirely QI, and encourage individuals to complete a one-page summary of their project. People can stop at the end of the self-assessment tool if they wish, but as I said, we're encouraging people to complete the one-page summary and submit it to the QI review committee, in which case the committee will review, two committee members will review, and they may ask additional questions of the project lead to make sure they're fully understanding what the project entails. And at the end of that review, the project lead will be provided an institutional review letter if their project is deemed entirely QI, which we hope it will be, because the self-assessment tool should screen out any projects that involve research, but it is a second check. If the project is determined to involve research, then project leads would be directed to the Start Smart process. Now, there is not going to be a mandatory report on an ongoing basis. We determined, at least as a starting point, that we would direct project leads that they would need to go back through this process if their project changed scope, which is quite common in QI projects. So we expect that the projects will change scope, and would expect that project leads will take themselves back to the beginning of the process and go through the self-assessment tool again to ensure that as their project has changed scope, it has not started to involve elements of research. So all of this information can be found on CHEOnet. So if you click on CHEO Next at the top of the screen, you will be taken to a screen that shows CHEO Works table of contents, and there is a section on there's a section on quality improvement project review that was added at the beginning of December. And if you click on that piece, you will get an option to click on information on completing the self-assessment tool, which will take you to a screen explaining how the self-assessment tool works. If you're already familiar with the self-assessment tool, you can just click on the next button down, which is to complete the self-assessment tool, and that will take you directly to the red cap link for you to be able to start that process. How the self-assessment tool works is it's broken into two sections. Project leads would complete section A, and if they answer yes to any of those questions, they will automatically be streamed towards the Start Smart process. If they answer no to all those questions, then you would go on to complete section B. And again, if the answer is yes to any of the questions, it will take you on to the Start Smart application. And then if the answer is no to all of the questions, then project leads would be encouraged to complete the one-page summary and send the self-assessment tool and the one-page summary to the QI review panel. Just to give you a sense of the characteristics that were used to develop the self-assessment tool, we have a list of them here, with research being the middle column and QI being the far right column. And so a number of different factors and areas were considered, some of which overlap entirely for research and QI, and others that are the differentiating factors. To give you a sense of what the one-page summary is, it's really meant to be one page. We are not expecting a really long application, because we don't want this to become a barrier to people moving forward with this process, or slow them down in getting started with their project. But we do need enough details to be able to provide some richness to the self-assessment tool and to help us to understand some basics about the project that will ensure that it is entirely QI. The QI Review Committee is comprised of CHEO staff and physicians who have expertise in quality improvement and research to be able to help with this process of differentiating. And the role is really to review the QI project to make a final determination on whether the project is QI or research. Now, we recognize that because of some of the overlap and the blurring between QI and research, there may be some projects that kind of fall in that gray zone. And in our conversations with the RAB, we're all on the same page that there may be some projects that we need to connect on to be getting the point of view of the RAB as well as the QI Review Committee to be able to make this determination. Our goal is not to put the project lead in the middle of that, having to bounce back and forth between the RAB and the QI Review Committee, but rather to do that process for them. If you received a response that suggested that your project is research and really don't feel that that's the case, then you could bring that back to the QI Review Committee and have a more lengthy conversation to try to better understand the project and to make a final determination. In addition to the new process and self-assessment tool being on CHEOnet, there are a number of resources available for QI project leads, including some CHEOWorks tools, CHEOWorks templates, tip sheets related to ethics and SMART goals, PDSA cycles, and run charts that we would encourage everybody to take a look at to help them in setting up their projects and following appropriate QI methodology. There are also links to research in the Start Smart process, the REB, and research data management at CHEO, which can be helpful, particularly for those projects that include elements of research. And that is all. I'll stop sharing so that I can see the group and the chat.
Thanks very much, Leanna. Huge amount of work. Huge thanks to you and Danielle and your team for putting this all together. We get lots of questions about QI. The REB gets lots of questions about QI. Many of our trainees are involved with QI projects. Many of us are involved with QI projects as part of certification with the CPSO. So a topic really of interest to everyone. Lillian Lai has put, where do we find the link to your screening tool? I think it's on CHEOnet in the CHEOWorks section, right?
That's right. So if you go to CHEOnet and across the top, there'll be a button that says CHEO Next. And if you click on that, you'll find the bar on the left has a CHEOWorks section. And if you click on that piece, it will extend and you'll see a new link that is the QI review process with all of the information and link to the self-assessment tool.
Rob Klassen says, this is fantastic. Thanks, Leanna. Carolyn Lavin says, can a research coordinator complete the self-assessment tool or does it need to be the project lead?
So we're not picky about who completes it as long as they have sufficient information to be able to fill it in. And we may want to link back with the project lead if we have additional questions, but we're not picky about who actually completes the self-assessment or one-page summary.
Other questions? Just looking for hands. We do have a lot of people on the call today. And I appreciate that people may want to look at all the information you provided and then they may have questions.
Yes, and we would encourage people to reach out to myself, Rebecca Brooke, who's the manager for CHEOWorks, or Danielle Simpson, or even our admin, Grace Scott, with any questions, and we'll respond to them. We know this is a new process, and so people will likely have questions. We're also planning to reach out to individuals who do complete the one-page summary, so who go through the whole process, to reach out to them sort of 6 months and a year from now to receive their feedback. But if you have feedback sooner than that, we would encourage you to let us know, once you've completed the process, if you feel that there are areas where things could be improved or pieces that went really well, because we will look to be optimizing this system over time.
Leanna, there's a comment or a question in the chat about a QI project being selected and associated funding and support. Do you want to just sort of reiterate the pathway again from this process to the QITI grants for people that maybe joined a bit late?
Yes, so the QITI grants have existed for some time. And now that this new process is launched, we've integrated it at the front end of the application process, that individuals who want to apply for a QITI grant would go through this process first to ensure, as a screening, that their project is a QI project. And then they would, assuming they meet the rest of the inclusion criteria, be able to apply for the QITI grant.
Great. Heather Howley you mentioned that a database of all QI projects is out of scope, but will you start with capturing QI projects that go through the QI review process, I guess, in a prospective way? If so, can staff access that information?
Yeah, so we will capture those ones that go through the whole process and complete the one-page summary, because we'll have enough information about them to be useful. We haven't yet kind of thought through how we're going to provide that information out to the organization, but that is on our list of things to do, as well as to find a way of just showcasing the great work that we're doing internally, and then of course externally through publications and dissemination. Our hope in the grand scheme, lofty goal, is to potentially be able to create a way to have a database of all of the QI projects that are taking place, to really be able to demonstrate our productivity in this area at CHEO.
Thanks, Leanna. Stephanie, good morning.
Good morning. Sorry, I'm late to put up my hand. I listened to the first half in the car. Thanks so much for presenting this. I think this is a really exciting development, absolutely. And thank you for allowing PAC and professional practice to also be a part of the process as stakeholders. Leanna, I guess I've asked this question before, and listening again to Claudia this morning and yourself talk about, the process and the distinction between QI and research. One area that still remains unclear is where program evaluation projects fit in this framework, because I appreciate that program evaluation has not been included in scope for the QI review process. However, practically speaking, the REB considers program evaluation and QI to be sort of not research. And so, the REB will say you need to go to the QI process with these program evaluation projects, and QI is saying, no, that's not part of our scope. So it kind of leaves a segment of work that is well established here at CHEO in terms of program development and program evaluation, particularly projects that I think do overlap to some degree with QI when we're talking about measuring the effectiveness of clinical service. So I just wondered if you could comment on that, and maybe I just wanted to sort of bring, again, elevate this question to see where in the process we might address this gap. Thanks.
Yeah, and I appreciate the question, Stephanie, or comment, even though we've had this conversation before, and I do appreciate the gap. I think that we need to find a place for program eval to have, potentially a similar kind of process, and then link it in to the already established process for the REB and this new process for QI. And for sure, and I've been witness to this, some program eval data or projects then evolve into QI, right? We use that information to be able to make improvements. And at that stage, we would say that that's QI, and this process kind of fits with that. But there's also that other part of program eval, which is just that, evaluating how our programs are doing without necessarily an intention to then improve, but monitoring how they're doing. So I don't have a great answer for you, except to say that I think it's a third arm, that we would hope to be able to create links with the other systems already so that it could make sense. I think one of the things that might be a little tricky is how program evaluation is, like the structures around program evaluation right now, without, or maybe you do know this and I just don't, is there sort of a lead to that, right? Or a program that oversees that could be, involved in developing a process or seeing how it links into other things, whereas, CHEO works with sort of a natural group to take on developing this project. And of course, the REB is an entity that exists and able to maintain that process of REB approval.
Yeah, if I could just, respond. I don't think there is a centralized kind of lead around program evaluation necessarily. My own experience with this obviously comes from within the discipline of psychology, and where this has been a component a component of our training program for over 20 years, that our residents complete a program evaluation project. And so we've developed a bit of we have a process within our training program. But much the same, there's been a lot of, over the years, a lot of discussion and attempts to clarify where program evaluation and research overlap, much like you've described the confusion around QI and research. Many program evaluation projects also, as you say, they evolve or they involve certain elements of research. But it's not always clear. And so historically, we have approached the REB for consultation around some of these projects, and they've, but it's very parallel to what has been laid out in terms of the process for QI and the need for clarification. So I agree, it is a third arm, and I'm not sure, the way forward, but I do want to make sure that there's awareness, and that, we certainly do need to have a closer look at how we're going to support those projects as well.
Maybe, Stephanie, I can suggest that, we look through the current process, like in detail, that, that Leanna's laid out, and see, is there sort of an opportunity to put a program evaluation pipeline, through that process, or whether we need to create an additional, parallel process. We don't want to complicate things too much, and we want to take advantage of existing structures, but also want to make sure that we have the right expertise. There's a number of questions in the chat. Are there regulatory and ethical considerations unique to QI projects as opposed to research projects?
So there are ethical principles, and it's important to follow ethical principles, even though there isn't a formal ethics approval for QI projects, or the need for, the mandated ethics approval for QI projects, but there are important ethical principles that we should always be following. We have created a tip sheet that will be added to the resources on CHEOnet as soon as it's formatted, as a starting point to help individuals better understand and really just reflect on those ethical principles. I don't think they're going to be shocking to anyone. It's just sometimes difficult or sort of not top of mind when people are developing these projects to think about the different ethical pieces to really consider, which include the impact on patients and families and burden on staff and how it affects the system. And really, important to be thinking about how likely is this project to lead to an improvement, and does it counterbalance the amount of effort that's going into it, and to continue to monitor over time to ensure that the effort is worth the outcomes that we're getting, as well as things around, patient autonomy and considerations of, who is being included and equity, these types of concepts. But it will be added in a tip sheet to CHEOnet within the next week.
Thank you. There's a question about filling out the form for ongoing QI projects.
Yeah, absolutely. You can. The self-screening will work fine. And I would encourage anybody who is at all concerned that their project might include elements of research to include it, whether it's an ongoing project or a new project. I know from speaking with the REB that sometimes they are picking up projects that are kind of completed or well on their way, that were presumed to be QI projects that then turned out to involve elements of research. They were picking these up as people were coming asking for the REB exemption letters. So, always a good idea to complete that self-assessment and just do a double check that your project is indeed fully QI.
Greg, sorry.
Oh, and I was just going to say, and if your project is ongoing and you are now because this process is new and you haven't received an REB exemption letter, but would want to have an institutional approval letter, you could complete the one-page summary and we'll review that project even though it's already launched, recognizing that there wasn't a clear process previously.
Great. Greg asks about training. Does the RI-CRU have a person team interested in providing QI methodology session or workshop? I saw that Jackie was on from the CRU, so she may want to comment. And I don't know, Leanna, if CHEO Works currently has sort of a formal education process that people can participate in. So maybe Leanna, you want to comment, and then maybe Jackie wants to comment.
Yeah, for sure. And so, we have had various training workshops and opportunities in QI over time. During the pandemic, things were really scaled back to the yellow belt, which we think is really important. We receive a lot of very positive feedback about the yellow belt, but it's 2 full days. And so we recognize that that's not really accessible for everybody, or it may be more than what some individuals need or are able to engage in. So we have just recently launched a project within our CHEO Works team to look at all of our training opportunities and to try to develop training opportunities to meet different needs. We had met with all of the PCLT co-leads to be able to better understand what different pieces of knowledge would be helpful. And so you will see that rolling out. It'll probably still be a few months, but rolling out with some different workshops, including on methodology, data, these types of pieces that are really practical for people to take in. And for those who already have some knowledge of QI, those individual pieces might be really useful. Happy to talk about offerings for trainees specifically. I'm a previous program director for child psychiatry and teach a curriculum to our child psychiatry subspecialty residents on QI. So it is near and dear to my heart, and happy to look at how we develop trainee specific trainings in QI.
Thanks, Leanna. Jackie?
So the CRU doesn't do QI, right? So we wouldn't be able to do a workshop on QI methodologies because that's not something we do. We do have instances where QI overlaps with research, and the methodology that's required is a research methodology. We have, previous to Leanna, I know that Rebecca, if she's on the call, we've met the CRU and CHEO Works often to try to figure out how we can put some synergies together, but it's very, very different methodologies that sometimes overlap, but very infrequently do. So I mean, we'd be more than happy to meet with Leanna and see if we could put something together as a group, but I'm not sure how that would actually work.
Thanks, Jackie. Melissa?
Good morning. One of my questions is in my, as part of my associate medical director hat, there's a lot of the work that we do that is like operations that is in fact QI, right? Because operations is continuously trying to improve your process, and you have one process and you want to switch over to another process. And what I find is one of the things that trips us up is around data, like, collecting data, and then iterative data publishing, and then analysis. And for example, being able to choose what's the metric that we're going to look to see that we've had an impact or not. Who is going to, on a bi-monthly basis, give us the information so that we can like visually track to see if our if the intervention we're doing is having an effect. And it's not immediately clear to me, in the hospital, who is the person who really helps with that, and sometimes who takes that cognitive load off. If you're a clinical team or you're a PCLT and you're like, we've identified the issue, we know what we want to try to do to fix it, we have these 4 interventions, and we have a sense of what the metrics are. One of the things we routinely run up against is we would need, these are longitudinal things, and we need to be able to see like what's the baseline, and then what's the delta over time. And I've
You're muted there, Melissa. We just lost the last part of what you were saying.
Sorry, what point did I mute?
So you talked about the baseline data and data over time, and then I think you dropped.
Oh, sorry. I meant to say, saying it's a lot of work as a clinician who's also trying to have has an administrative role to also summarize the data, analyze the data, and provide it to the team on a regular basis. So I've often wished that there was like a hub in the hospital that would be, once the clinical team or the PCLT has said, we've identified what we'd like to do, the metrics, we have a sense, we maybe have someone who we can consult with to make sure that we're analyzing the right metrics. And then someone who has like a pace essentially of providing in like a nice, like a format that is shareable to say, okay, this is week 2, this is week 4, and then be able to provide that, because I find that that's sometimes where we don't complete the cycle of QI, or it's not really metrics based, because we get overwhelmed by the sheer time it takes to ask for the data, analyze it, and then produce it in something that we can share. So thank you. It is like, this is great, and it's great to have these rounds, and I'm so excited.
Thank you. And yes, so data is an important part of QI, and excellent to hear your focus, as difficult as it is, to be looking at the data over time and being able to really determine if the change was an improvement and has affected the metrics that you were hoping for. Data at CHEO really comes from the BI team, from the business intelligence team. And so the CHEO Works team does work closely with BI to try to get data for the projects that CHEO Works is supporting. But really it's BI that is able to provide the data itself. And it is possible in consultation with BI to ask for standard reports to be able to be run on an ongoing basis, or most recently, they're very engaged in developing dashboards that then have, the data on an ongoing basis to be able to make it accessible to folks. As far as sort of consultation on, are these the right metrics? Are we looking at the right things? So depending on the project, because CHEO Works doesn't have the resources to support all QI projects, and encourage folks doing projects at the local level to take those first to their PCLT co-leads, and then to have the PCLT co-leads come forward to CHEO Works. But it is possible to get consultation from CHEO Works on those types of specific pieces, and then we can work with business intelligence to look at opportunities for that data to be extracted on a proactive basis, so that the project leads aren't asking and then waiting 3 or 4 weeks every time to get the data to be provided.
And just to link those names with people, like business intelligence, for example, is Justin Bygrove and then Rebecca Brooke at CHEO Works, correct?
Correct. Yep.
Okay.
Great, thank you. A couple more questions. I knew people would be very engaged with this. So Waleed asked, traditionally QI and patient safety are linked. However, KT and implementation science are quite different processes. Is the stream going to include KT? The grants certainly include KT, but
yeah, for sure. And some KT is QI, and some KT is not entirely QI. So certainly encourage folks to still access this process, and really depending on the type of KT that is being completed, it could quite likely fall within quality improvement. And this new process is required for the QITI grants, but it's not necessarily required that you fall into the process of it, the self-assessment tool completely saying that it's QI. If you complete the self-assessment tool, but you need to move forward with the rest of the process to be able to move on with the QITI grant, or just because you don't believe the self-assessment tool accurately determined that your project was research, you can still complete the 1-page summary, send it to the QI review committee, and we'll have a conversation about it.
great. Radha Jetty asks around working with Indigenous people and around the OCAP principles used for research, and do those apply for QI projects with that population?
Yeah, so I think, and I can see in your in your comments here about the importance of ethical principles, which include being considerate to the different populations as well as inclusivity and equity. So absolutely all those things are important. And our hope is to raise people's awareness of the importance of following all of those types of ethical principles and just good approaches to interacting with different populations, even though there isn't a mandatory requirement in the same way that there is for research to have that fully reviewed. But so the onus rests a lot more on the project lead. But what we see our role and our goal is to help to raise awareness about the importance of those things.
Great. And then Sahar asks around considerations for sustainability of the improvements made to share them across the organization. I think you touched on that a bit in your presentation.
The sustainability of the improvements, Sahar?
Yeah, I think the dissemination, piece.
Yeah, so there's two pieces. So one is the sustainability or maintenance, right? Which we hope we'll be able to infuse a little bit more, because we recognize that sometimes that's not always what's happening with QI. But for folks completing the one-page summary, we do include, we want to hear, more information about the project, including a piece about, how is it going to continue to be monitored? What are the control metrics going to be to make sure that these things are sustainable? And we are going to check back in with the project leads at 12 months to ask, as a prompt about how they're doing with their project and where are they at and what's going well or not. And then as far as sharing them across the organization, so we will know more about the projects that are taking place. And as part of, not specifically part of the QI review process, but linked into the CHEO Works team, we're looking at opportunities for how we celebrate all these projects that are occurring internally, not just, through communications in the improvement zone, which is something that we've done previously, but even having like similar to Research Day, a QI Day, to be able to allow people to showcase their projects. And given that we'll have more information about the projects that are taking place, we can encourage people to participate in that sort of forum.
Leanna, I just want to add a small thing about reporting. Is there a process where, QI projects will be reporting back so that kind of, you'll have all this information, and then there will be opportunities to disseminate this information within the organization, right? Lessons learned, is there any process that's going to be implemented around, how we can report back? Or
yeah, so we did reflect on that, recognizing that in some organizations there is actually mandatory sort of reporting every 6 months. We have not implemented that at this stage, although, something for us to be considering moving forward. We need to start with something that was manageable, as well as something that didn't feel overwhelming to people, to kind of get them used to this process. But we didn't want to make it really onerous, because it's not a requirement for QI, right? So we are sort of basing it on people just being willing to do it. But as I said, we'll reach out to leads at 12 months to kind of say, how are you doing? And people can reach back out to us or complete the process again if they change scope. And I can see that Jason is looking like we're running out of time. But I'll just say, if there's other questions, please reach out to me via email on my CHEO email, and I'm happy to respond.
Thanks so much. Thanks, Leanna. We are at time. A huge thanks to Leanna and Claudia for their presentations. I also want to thank Samira and Triana and the Grants Office for all their work on developing the QITI grants and continuing to iterate those. All of you for your engagement and questions. I think this is the last grand rounds. So want to wish everyone a happy holiday season and hope you get some time to relax and rest with family and friends. And please join us for our CHEO Research Award celebration next Wednesday at 11 o'clock on Teams. So thanks very much, everyone. The evaluation is in the chat, and have a great day.